Today, we're going to talk about mitral stenosis. It's something that we don't see a ton of in the operating room, so I thought it'd be worth talking about today. Rheumatic mitral stenosis is the most common type of mitral stenosis in the world, though not in the US, as rheumatic fever is not as common here. In the zoomed in echo image of the mitral valve, we can see thickening of the leaflet tips. They form what we call a hockey stick appearance, which signifies rheumatic mitral disease. Why is this important for you to note as a general anesthesiologist? Well, it might come up on the OSCE portion of your oral boards. Additionally, there is commissural fusion. This leads to a reduction in leaflet opening. Calcific mitral valve disease is the most common cause of mitral stenosis in the US. It can result from connective tissue abnormalities, hyperparathyroidism, lupus, rheumatoid arthritis, carcinoid disease, amyloid deposition, mediastinal radiation therapy, systemic hypertension, etc. A normal mitral valve area is 4 to 5 square centimeters. When your valve area begins to decrease to 2.5 centimeters, you start to get significant stenosis. In order for blood to flow across the valve, you need to increase the gradient across it. I want to pause here for a second to remind you that in mitral stenosis, we want the patient to have a slow heart rate. The reason for this is that we need both time and this gradient generated to promote forward flow across the valve. As the pressure gradient increases, the LA begins to enlarge. As we know, atrial enlargement can result in arrhythmias such as atrial fibrillation. This is the most common arrhythmia we see in mitral stenosis. When patients flip into AFib, they lose their atrial kick. As we mentioned before, we need an AV pressure gradient to get blood across the valve. With a fibrillating atrium, we lose that. As you can imagine, this loss of atrial kick is devastating for patients in mitral stenosis, so it is important to keep them in sinus rhythm. Once this loss of atrial kick occurs, pulmonary hypertension and RV failure result. As you can see, this is truly a downward spiral. When looking at an echo report, you'll often see numbers associated with mitral stenosis. The ones that I want you to focus on are the mean pressure gradient and the mitral valve area. They are the most clinically significant in grading the severity of mitral stenosis. When we talk about severe mitral stenosis, we're talking about a mitral valve area less than 1 and a mean pressure gradient greater than 10. So, some take home points. Really try to understand that downward spiral. Keep your patients in sinus rhythm and with a slow heart rate. That's all I've got for today on mitral stenosis.